negotiator and co-lead of the Action Agenda Initiative team for the COP29 presidency, and Ethel Maciel, Secretary of Health Surveillance and Environment, for a conversation moderated by Foreign Policy's Andrew Solinger on aligning climate goals with health outcomes.
Hello and welcome everyone. We have an important topic we want to discuss right now, and that is building on the momentum of the first ever Health Day at COP. That was in UAE, and there's a critical need to keep it on the COP agenda, especially as we head into Baku for COP29. And luckily for us, we have the Health COP Troika with us, and so we're very excited to be speaking with them. Maha Barakat is Assistant Minister for Health and Life Sciences at MOFA of the UAE. Elmar Mammadov is a Senior Negotiator and Co-Lead at COP29. Ethel Leonor Noia Maciel is the Secretary of Health at Brazil. Welcome back. We spoke last year at our Health Forum. I wanted to point out that Maha may have to leave a little bit early. She's been called to a ministerial and needs to boogie back to the UN. So we're going to go straight to you, Maha, and talk a little bit about what we learned at the first ever COP Health Day in the UAE last year. That was an important moment because climate change is incredibly threatening to global health systems, and there's an urgent need to take concerted actions, and there's no better place to do that than at COP. Tell us a little bit about that day, what actions were taken, and what potentially could be improved. Thank you,
and good afternoon, everyone. So it actually didn't start on the day in November last year. The discussions had been building up from Fiji 23 to Glasgow COP26 with the Attach coalition created. And then when it came to Dubai COP28, it was really the logical next step. We needed to ensure it happened. And we put all our efforts with many partners, particularly the WHO, to ensure that one whole day was dedicated to health, covering issues that are related to the climate-health nexus. That was the first time, and on that day we held the ministerial. We'd expected, a few dozen ministers to come. We had over 108 health ministries represented. There was a declaration that was prepared. Again, the WHO told us, we can aim for 50 signatories. You'll be lucky if you get 50. We ended up with over 150 signatories to this health climate declaration. And what's so wonderful is that with our colleagues here to my left, we're going to have a COP day at Baku, and we're going to have a COP day at COP30 in Brazil. And they say that once you have 3 consecutive COPs holding some event, it's now embedded, it's enshrined, it's going to happen forever. So this is fantastic news. This is really wonderful news. And going back to Dubai, so on that day, in addition to the declaration and the ministries, there was a pledge of $1 billion to be used for climate health issues around the world. And I think at the end of the day, what do you look for? I mean, why are we doing this? Ultimately, it has to be to save lives. It's not about numbers and, gigatons of this or emissions. It's really about how many lives can be saved as a consequence of the initiatives that will be put in place as a consequence of these COPs. And if we had to give three comments or 3 kind of topics that need to be taken forward. Firstly, we would say for the nationally determined contributions, please institutionalize targets for health in there, and be they things like the impact of air pollution on health, be they heat stroke, be they mental health issues, number of events prevented, whatever they are, please institutionalize certain metrics of health inside your nationally determined contributions. Secondly, we've seen how many agendas are very important to the WHO and the UN. Last year's pandemic treaty, which still hasn't been signed, this year antimicrobial resistance, and now we've started non-communicable diseases building up for over the next 52 weeks for next year. These are all issues these are all agendas that can be under the umbrella of climate and health. They all impact health and are impacted by climate. Add to it universal health coverage, add to it gender, add to it poverty. So there are several agendas that actually overlap with the climate and health nexus. And we should maximize the opportunities to remind everyone to include health in that. And then finally, the funding aspect. We can't do any of this without more pledges. And we're really hopeful that there will be more pledges at Baku and in Brazil. And very interesting discussions over the last 2 days. On Monday, one eminent economist was saying, the health community needs to put a number. What are we talking about? What's the number that the health community needs to make a difference for climate and health issues? And then there were others that said, well, how do you define, what do you mean by health issues impacted by climate? What are they? Is it a small definition, or do you cast a wider net? And obviously, the wider the better. If you're going to include antimicrobial resistance, if you're going to include non-communicable disease, if you're going to include pandemics, the wider the better, and argue that actually climate is important to all of them. I'm sorry, I've talked a lot, but
no,
over for me.
all good.
You.
Thank you, Maha. Those are very good points, very helpful. And that's a good baton pass to Baku. You can applaud. I think that's appropriate. Very heartfelt. And as you know, we do not solicit questions from the audience live. It just takes too much time, and people don't use question marks at the end. But we do solicit them in advance. And we actually got a question for Elmar, and that question is squarely onto Baku. So this is from Marilyn Sanema, who is the Netherlands Vice Minister for Public Health. And she asks, as the Netherlands has been leading the new WHA resolution on climate change and health, seeking to integrate climate into the work of the WHO, we'd be interested to hear from the speakers and you, Elmar, in terms of follow-up on what you see as concrete opportunities for COP29 to help also better integrate health into the UN climate process.
Thank you. Thank you very much. I would like to inform you that we used 5 key principles for designing of COP29 presidency-led initiatives. First of all, to find balance between 3 pillars of climate agenda: climate finance, mitigation, adaptation. Second principle that we used is a balance between enhancing ambition and enabling action. Third principle, balance between 3 dimensions of sustainable development: economic, environmental, social. Number 4, to have in our list not only global initiatives, but also regional initiatives. And number 5, harmony between human and nature. And particularly for integration of health, prioritizing health topic in our agenda, we have 2 important global initiatives. First of all, Baku initiative on human development for climate resilience. Mm-hmm. And under this initiative, we will tackle multi-sectoral synergy between education, health, jobs, skills, and children and youth. And second, most very important initiative on cities. It's a multi-sectoral actions pathways to resilient and healthy cities. We'll integrate the topic of health into the city planning issue. Under the first initiative on human development, also we have 2 important innovations. First of all, we would like to create a coalition of COP presidencies, continuity coalition of COP presidencies on climate and health topic, to bring together, starting from Fiji, UK, Egypt, United Arab Emirates, Azerbaijan, Brazil, to create such a coalition of COP presidencies, and also to try to keep this topic on a permanent basis on the climate agenda. Also, under the cities initiative, we have the same approach, creation of coalition, continuity coalition on urban climate action, also for cities front. That's why these two topics, two initiatives, we will tackle this issue, health topic. Also, we will tackle through the high-level round table One Health and human development topic.
Excellent. And it's not just, thank you for sharing all of those initiatives, and those sound many and important, but it's not just urban. Aren't you also targeting rural development as well with your Harmonia for Climate Resilience program? Could you explain that
we
for a
have
moment?
also initiative Harmonia, particularly for farmers, and also under the Harmonia initiative, we will tackle climate resilient village topic and farmers, particularly women and youth farmers, and health also will be one of the key elements.
Right, that borrows a little bit from the One Health initiative that we'll be talking about in AMR a little bit later. Secretary Maciel, let's move over to Brazil and look forward to next year. And I think that was great that Maha talked about making, after 3 COPs, it's permanent, right? It's written in ink.
Yes.
What steps can Brazil's COP30 leadership take to prioritize health and climate discussions? Similar type of initiatives? It's early, but what types of discussions and initiatives are being talked about?
Thank you. We start with the G20 presidency, that we put a declaration in climate change and with One Health approach, looking specifically for AMR. And we are working this declaration with G20. We expect that next October we will finish this declaration. We are in negotiation right now. And the next step is to bring all this declaration to the COP30 in Brazil. Brazil is putting in the climate change a lot of the working in equity for health, because this is what we are seeing in Brazil in the last 18 months that we are in this new government. We create under my Secretary of Health and Environment, this new name, environment, came from health, and the secretary was more abroad right now. And we have a specific coordinator to work with climate change and equity in health. We know Brazil was hit in this year for the biggest dengue epidemic forever. And this was a very consequence of the climate change and the high temperature that we are facing in Brazil and in all of the world. So Brazil has a universal health system, is one of the biggest with the 200 million inhabitants in the world. And different from other countries, health is the second budget of the government. So it's a biggest budget. And nothing is enough. It's not enough, but it's the biggest, the second biggest budget from all the government. So this create opportunity to see all the impacts and create indicators that we can follow for the next year. We are seeing the increase of some infectious disease. I point out dengue. We saw an emergence of Oropouche fever that we have like a very few cases, and right now it's a problem. So we are seeing this difference. And right now what we want to do in the COP30 is put health as an argument for climate change, because climate change sometimes is abstract, but health can give a concrete indicator for this.
You're quite right, and you brought up some excellent examples, and we only have a few seconds left, but I wonder if we could also talk for a moment, Maha, and also Elmar, each of you, how your health systems are changing. Let's forget about COP, how your health systems are changing to take into account climate change and the impacts therein. And how much of your government budget is spent on healthcare versus Brazil's? Maybe, Maha, you could start us off.
So health, as in many countries, will take up either the number 1, 2, or 3 budgets in any local or federal government. And I think we are privileged in the United Arab Emirates to be able to allocate the appropriate funding in a very well-resourced country. We have universal health coverage, we have strong health systems. So the building blocks for what you need to be climate resilient are there. Never underestimate the importance of health system strengthening, never underestimate the importance of very strong public health measures, and never underestimate the importance of universal health coverage. Everyone needs treatment.
Great. And Elmar, in
Uh,
we are investing a lot to the health sector. We are constructing new green hospitals, and also we are investing to human capital in the field of health in our capital city in Baku and also in the regions. Health sector, it is one of the top priority for government. Human capital topic is top priority. And also, as I already mentioned, it is one of the important elements in our budget.
Excellent. We're out of time, but a great note to end on. I want to thank the COP Troika. Great handoff from the UAE to Azerbaijan and now to Brazil. Thank you for all the good work that you do. Please thank our panelists.